My name is Stephen Chung. I'm the Senior Vice President of Supply Chain and Real Estate for SCL Health. Thank you for the opportunity to present our project and OTP Amendment request at this City Council meeting. I want to express our appreciation of having this virtual meeting to accommodate our request in these extraordinary times. I would like to cover 5 areas: provide you background on SCL Health and the Lutheran Medical Center, show the site location of the project, discuss the proposed amendment, provide project information for the proposed medical campus, and finally, discuss the process we have undertaken. I would like to start our conversation by providing some background on SCL Health. We are a faith-based community healthcare provider. Who we are is reflected in our mission, vision, and values, with a focus on serving communities, especially the poor and vulnerable. Our commitment to the community is reflected in the community benefit we provide. In 2018, we provided over $240 million of charity care and community programs across our system. SCL Health is headquartered in Broomfield, Colorado, has 8 hospitals and 140 plus clinics serving Colorado, Montana, and Kansas. Specifically to the Denver metro area, SCL Health has been serving the Denver community for nearly 150 years. Our first hospital, St. Joseph's, opened its doors in 1873. The last new medical campus SCL Health built was Good Samaritan in 2005. I would like to pivot our discussion to the Lutheran Medical Center. Lutheran has a long legacy in the community of Wheat Ridge, starting in 1905. More specifically about the Lutheran Hospital and the Lutheran campus, currently Lutheran has 400 hospital beds, employs 2,000 people with 900 physicians providing services and 600 volunteers. We are the largest employer in the city of Wheat Ridge. Annually, we have 12,000 inpatient stays, 6,500 ER visits, 2,000 births, and 120,000 outpatient visits. Lutheran plays a significant role in providing community benefit programs to Wheat Ridge and the surrounding communities. We've partnered with over 200 different community organizations in Jefferson County to do a community needs assessment to tailor our programs to meet the needs of the community. In 2018, we provided $37.5 million in community benefit. And most importantly, Lutheran provides quality health care. We are consistently recognized by various healthcare associations for our quality care. Pivoting to the project, I would first like to discuss our site location and new medical campus. The Lutheran Medical Center's new home will be located at the southwest corner of I-70 and the Highway 58 interchange. It is approximately 27 acres in size and is part of the new 100-acre Clear Creek Crossing mixed-use development. Closing our discussion on the site location, here are the views from I-70 looking west and from 40th Avenue looking north. I would now like to discuss the specific OTP amendment. First, it is important to understand that the proposed uses, a hospital, a helipad, and medical office buildings are currently allowed under the existing zoning. We are making one request, an increase to the allowable height of the hospital. We are asking for a height increase from 90 feet to 102 feet for the patient floors and a height increase to 135 feet to accommodate a helipad, elevator, and vestibule. As for the overall project, this is the conceptual layout. SCL Health will be replacing the Lutheran Medical Center with a new hospital with approximately 250 beds and 2 medical office buildings. The new hospital will be a state-of-the-art medical facility that will incorporate the latest technology and design to deliver outstanding clinical care and the best patient and community experience. We believe that it will be a healthcare campus that Wheat Ridge can be very proud of. This is an aerial view looking from above from the I-70 and Highway 58 interchange. The hospital and MOBs are shown in gray fronting I-70. The parking structure is shown in purple and the adjacent apartment project is shown in yellow. Here is an aerial view looking northeast. This is a view of the hospital building along I-70. Here you can see the small footprint of the elevator run for the helipad. This is a view in the other direction along I-70. The hospital sits low in a small valley, part of the overall Clear Creek topography. Here is a view from the Applewood Golf Course. This slide shows the current zoning for the 90-foot hospital with an elevator overrun. For comparisons, this is the same view with the proposed height of 102 feet for the hospital and the 135 feet for the elevator overrun. We have also included visuals on the impact of the height increase from the neighborhood where a protest has been filed. Here is the view at the current permitted 90-foot height. By contrast, here are the views with the proposed height increase. The impacted view plane is northeast and towards I-70, and we believe the change to be subtle. Here is a building section diagram of the proposed hospital on the right. The building section shows the proposed 6 stories, which is the same number of stories at the existing Lutheran hospital, shown on the left. The 2 buildings are the same number of stories. The additional 11 feet is for increased floor-to-ceiling height, which is needed to meet today's building codes and to accommodate the size of today's medical equipment. Shifting specifically to the helipad, first it is important to understand that the helicopter transport is a vital part of our hospital's operations, moving our most critical patients to and from our hospital. This view shows the area where the 135 feet in height is needed for the elevator and vestibule. This is shown in red. As you can see from the design, the overall overruns represent a small footprint relative to the overall development. We estimate 5 flights a month. There are 3 important factors in understanding why the helipad on the roof. The first is patient safety and speed. Placing the helipad on the roof of the hospital is the safest and most effective solution for the majority of hospitals and most certainly for this location. Helipad roof placement supports the fastest transfer of patients from the helicopter to the emergency facilities and procedural areas within the hospital. By contrast, a ground-based helicopter requires patients to be moved in and out of an ambulance, losing valuable time. Secondly, noise. Due to the height of the helipad, the helicopter will spend less time at lower altitudes, thus reducing the impact of the surrounding community. Lastly, the rooftop is a more controlled environment, eliminating any risk of public interference or debris. In this slide, we show the typical flight path for inbound and outbound flights to the south, north, and northwest. As you can see, we leverage the interstate and Highway 58 to minimize the impact to the local communities. There has also been some questions about the noise, so we wanted to provide some estimates. At the typical operational altitude of 500 feet, we estimate the noise at ground level to be 90.3 decibels. This is equivalent to the noise levels already created by I-70 traffic. Here is the estimated noise level of the helicopter at the 100-foot height of the helipad. Although the helicopter will spend very little time operating at this height, the noise level of the nearest community would be equivalent to a gas-powered lawnmower. By contrast, the alternative, a ground-based helipad, will be louder to the nearby residents. To provide a specific reference to our height requirement, we have referenced the completed St. Joseph Hospital in Denver, showing the height of the elevator run. The project was constructed in 2013 and is a good example of what is proposed. There is a slight height difference in the proposed height of 2 feet to allow for any change in elevator technology from when St. Joe's was built. Lastly, I would like to provide you an overview of the process and timing. In terms of the process that we have completed, we met with the city staff in September of 2019 to discuss the project. We conducted a neighborhood meeting last October. We submitted an OTP amendment at the end of last year. The Planning Commission approved the OTP amendment on February 20th of 2020. This brings us here today for City Council approval. In closing, Lutheran Medical Center is committed to continuing our legacy of collaboration and support with the city of Wheat Ridge and its surrounding community. Lutheran will continue to be a good neighbor, contribute to the vitality of the business community as the city's largest employer, provide high quality, low cost health care to patients and the families that we have the privilege to serve. We thank you for your time and look forward to continuing to facilitate an open and engaging dialogue as our plans develop. Thank you.